This exercise is specific to external rotation of the hip. You can see I've got a band there that is creating some awareness deep inside the front of the hip, also engaging with the middle side of the hip, the medial side of the hip. I've got a weight here. So you need a few things. You need that band that we've likely talked about and you've already purchased. You'll need a weight somewhere around 20 or 30 pounds. This weight is not because, and the band is not because we're pulling against anything necessarily or lifting anything necessarily to strengthen, but to engage the core and to bring some awareness to the structures that we're trying to affect. So we're going to look at this in a couple of views. So go ahead and get your equipment together, the band, the weight, if you have it, and let's get going. Okay, this side view makes it a little more clear for you. You can see that the band is secured well behind me. Once again, you saw that front view. You'll see that again. The band is well up inside the hip crease at the front of the hip. And again, I don't need a lot of tension through here. I just need more awareness at the hip. I also need the, in essence, we're trying to seat the ball inside the hip socket really well so that we create as much awareness through the mechanoreceptors of the hip as possible. I'm not strengthening anything. I'm not pulling on this band as hard as I can. You can see the weight over here. The weight is, again, start with about 20 or 30 pounds. That's going to be very important because as you'll see, and I've slowed this video down so you can get a better view of this, as you'll see, so initially what we do is turn that leg into as close to 90 degrees as possible. We want external rotation of that hip. Now I lunge in. You can see the heel coming up slightly. Try to keep that heel down. We want that knee to go as far forward as we can, getting motion through the hip, as well as even working on our ankle dorsiflexion a little bit. Now I pick up the weight. This is going to change, along with the band, this is going to change the input, the neuromuscular input into the hip, even into the ankle and knee, even through the core. We're creating proximal stability, which allows for distal mobility, and that'll happen at the hip. That'll also happen at the ankle. So now we'll take a look at this from the front view. Once again, you can see that the band is well inside the hip crease. I've turned my hip externally rotated the hip as much as possible. We do a few just to get a sense for what is going on without the weight, and then we'll pick up the weight and try it again. And the majority of you will notice that with the weight, with that increased proximal stability, you will generate some distal mobility, not just at the hip, but at the ankle as well. You're going to get much more out of this exercise simply by picking up a moderate weight. Kettlebell or a dumbbell, either one, really doesn't matter. So I hope that was helpful for you. Again, this is a new exercise. This is going to be challenging for some of you. Stick with it. As with anything, the key to any movement dysfunction and any injury that we have is simply persistence, consistency over time. You will get there, just stick with it, and I am here as a resource for you. Ask your questions, send your text, send your emails. Thanks for watching, and I will talk to you soon.